Question number 1. What is the first priority when arriving at the scene of an emergency? The right option is option D. Ensure your own safety. Question number 2. What should you do first if you find a person who is unconscious but breathing? The right option is option C. Place them in the recovery position. Question number 3. The first step in performing CPR is. The right option is option B. Check for breathing and responsiveness. Question number 4. In case of severe bleeding, what is the most effective first aid action? The right option is option A. Apply direct pressure. Question number 5. Which of the following is not a symptom of shock? The right option is option D. Slow, steady breathing. Question number 6. What should you do in case of a burn injury? The right option is option A. Run cool, not cold, water over the burn. Question number 7. A person experiencing chest pain and shortness of breath may be having. The right option is option D. Heart attack. Question number 8. The first aid for a fractured leg includes. The right option is option C. Immobilize the leg and seek help. Question number 9. What is the best way to treat a nosebleed? The right option is option B. Tilt head forward and pinch the nose. Question number 10. The first aid for a snake bite includes. The right option is option D. Immobilizing the affected part. Question number 11. If someone is choking and cannot speak, what should be done first? The right option is option B. Perform abdominal thrusts, Heimlich maneuver. Question number 12. What is the first step in treating a victim of electric shock? The right option is option C. Turn off the power source. Question number 13. Which item should not be included in a first aid kit? The right option is option D. Expired medicine. Question number 14. What is the appropriate action if someone has a seizure? The right option is option A. Remove dangerous object around them. Question number 15. In the case of poisoning, what is the most important first aid principle? The right option is option D. Identify the poison and seek medical help. Question number 16. What is the recommended action for someone having a heat stroke? The right option is option C. Move to a cooler place and apply cold compress. Question number 17. Which of the following is a sign of internal bleeding? The right option is option B, pain and swelling with no visible wound. Question number 18. What is the correct first aid step for chemical exposure to the eyes? The right option is option B, flush with clean water for at least 15 minutes. Question number 19. Which is the safest way to help a person in a drowning situation? The right option is option D, throw a floating device and call for help. Question number 20. The term ABC and first aid stands for. The right option is option B, airway, breathing, circulation. Question number 21. In case of a spinal injury, the best first aid approach is to. The right option is option A, keep the person still and avoid movement. Question number 22. What is the best treatment for hypothermia? The right option is option D, gradually warm the body and cover with blankets. Question number 23. For a choking infant under 1 year, what should you do first? The right option is option B, back blows and chest thrusts. Question number 24. If a person faints, the first thing to do is. The right option is option D, lay them down and elevate their legs. Question number 25. What is the first step when you find a person collapsed on the ground? The right option is option A, check for responsiveness and call for help. Question number 26. Which of the following is a symptom of a stroke? The right option is option D, slurred speech and facial drop. Question number 27. In first aid, golden hours refers to. The right option is option A, first hour after injury for best survival. Question number 28. First aid for a bee sting includes. The right option is option A, scraping the sting with a card or blunt edge. Question number 29. Which pulse site is commonly checked in an unconscious adult? The right option is option D, carotid. Question number 30. In burns, which degree is characterized by blister formation? The right option is option B, second degree. Question number 31. What should you do for a conscious adult who is choking? The right option is option B, give back blows and abdominal thrusts. Question number 32. What is the first aid for a knocked out tooth? The right option is option C. Place it in milk or saline. Question number 33. What is the color of blood in arterial bleeding? The right option is option B. Bright red spots and heartbeat. Question number 34. What is the initial treatment for a sprained ankle? The right option is option D. Rest, ice, compression, elevation. Question number 35. The first aid for someone who is hyperventilating is to. The right option is option C. Encourage slow breathing or use a paper bag. Question number 36. Which of the following is not a component of the primary survey and first aid? The right option is option D. Dressing the wound. Question number 37. The first aid for a person with a suspected neck injury includes. The right option is option A. Keep head and neck immobilized. Question number 38. In CPR, where should chest compression be performed? The right option is option B. In the center of the chest on the lower half of the sternum. Question number 39. What is the proper depth of chest compressions during CPR in adults? The right option is option A. At least 2 inches. Question number 40. For a first degree burn, which of the following should be done? The right option is option B. Use cold water and clean dressing. Question number 41. A tourniquet is used only when. The right option is option C. Bleeding is life-threatening and cannot be controlled. Question number 42. When caring for a conscious person with a complete airway obstruction, you should. The right option is option D. Give back blows and abdominal thrusts. Question number 43. What should be checked before giving CPR? The right option is option A. Scene safety, responsiveness, breathing. Question number 44. If the patient is breathing but unresponsive, you should. The right option is option D. Put them in the recovery position. Question number 45. Which vital sign is most likely to change first in shock? The right option is option A. Pulse. Question number 46. First aid for a dislocated shoulder includes. The right option is option C. Immobilizing and supporting the limb. Question number 47. For someone bitten by a rabid animal, the first aid includes. The right option is option B. Washing with soap and water. Question number 48. Which one is a priority in a multi-casualty emergency? The right option is option D, bleeding victim with weak pulse. Question number 49. The most important action for a patient with suspected heart attack is to. The right option is option C, keep them calm and call emergency services. Question number 50. In case of a fire emergency, the first thing to do is. The right option is option A, stop, drop and roll if clothes catch fire.